Hello and welcome back to my channel. Today we're going to talk about dysphagia, a condition that makes it difficult to swallow. Dysphagia can significantly impact your quality of life and health, so it's important to understand what it is, how it's diagnosed, and how it can be managed effectively. Hi, I'm Dr. Knapp, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Dysphagia is a medical term for difficulty swallowing. It can occur at any stage of the swallowing process, from the mouth to the stomach. There are two main types of dysphagia, oropharyngeal dysphagia and esophageal dysphagia. Oropharyngeal dysphagia involves difficulty initiating the swallow and is often due to problems in the throat or mouth. Esophageal dysphagia involves difficulty moving food or liquid through the esophagus and into the stomach. Dysphagia can be caused by various conditions. Neurological disorders such as stroke, Parkinson's disease, or multiple sclerosis can disrupt the coordination of the muscles involved in swallowing. Structural abnormalities, such as tumors or strictures in the throat or esophagus, can also obstruct the passage of food. Other causes include gastroesophageal reflux, or GERD, which can lead to inflammation and scarring of the esophagus, and conditions like achalasia, where the muscles of the esophagus fail to relax properly. Symptoms of dysphagia can vary depending on the underlying cause and severity of the condition. Common symptoms include difficulty swallowing, pain while swallowing, a sensation of food getting stuck in the chest, coughing or choking when eating or drinking, and frequent heartburn or regurgitation of food. Some people may also experience unexplained weight loss, drooling, or a hoarse voice. If you experience any of these symptoms, it's important to see a healthcare provider for evaluation and diagnosis. Dysphagia can lead to serious complications such as malnutrition, dehydration, and aspiration pneumonia, which occurs when food or liquid enters the lungs. Diagnosing dysphagia involves a thorough evaluation by a healthcare provider, which may include a detailed medical history, physical examination, and various tests. Your healthcare provider will ask you about your symptoms, including when they started, their frequency, and any associated symptoms like weight loss or coughing. They may also inquire about your medical history, including any neurological conditions, surgeries, or medications that can contribute to swallowing difficulties. A physical examination may include an assessment of your mouth, throat, and neck to check for any abnormalities. Depending on your symptoms and physical examination findings, they may recommend additional tests to further evaluate your swallowing function. One common test is a barium swallow, or esophagram. During this test, you will swallow a liquid containing barium, which coats the lining of your esophagus and makes it visible on X-rays. This test can help identify structural abnormalities such as strictures or tumors, as well as assess the movement of the esophagus. Another diagnostic test is a video fluoroscopic swallowing study, or VFSS, also known as a modified barium swallow. This test involves swallowing different consistencies of food and liquid mixed with barium while a special X-ray camera records the swallowing process. This allows the healthcare provider to evaluate the coordination and movement of the muscles involved in swallowing. An endoscopy may be performed to directly visualize the inside of the esophagus and stomach. During an endoscopy, a thin, flexible tube with a camera is inserted through your mouth and into your esophagus. This test can help identify structural abnormalities such as tumors or inflammation and allow for biopsy if needed. Manometry is another test that measures the pressure and coordination of the muscles in your esophagus. During this test, a thin tube is passed through your nose into your esophagus to measure the muscle contractions during swallowing. Managing dysphagia involves addressing the underlying cause, relieving symptoms, and preventing complications. The specific treatment approach will depend on the type and severity of dysphagia, as well as the underlying cause. For oropharyngeal dysphagia, swallowing therapy is often the primary treatment. A speech-language pathologist can work with you to improve your swallowing function through exercises and techniques that strengthen the muscles involved in swallowing. They may also recommend strategies to modify your eating and drinking habits, such as taking smaller bites, chewing thoroughly, and using specific swallowing techniques. For esophageal dysphagia, treatment may involve medications or procedures to address the underlying cause. If GERD is contributing to your dysphagia, medications such as proton pump inhibitors or H2 blockers may be prescribed to reduce stomach acid and relieve inflammation of the esophagus. If esophageal strictures are present, a procedure called esophageal dilation may be performed by a gastroenterologist. This involves stretching the narrowed area of the esophagus using a special balloon or dilator to improve the passage of food. In some cases, surgical interventions may be necessary to treat dysphagia. For example, if a tumor is causing an obstruction, surgery may be performed to remove the tumor. In cases of achalasia, a surgical procedure called a Heller myotomy may be performed to cut the muscles at the lower end of the esophagus, allowing it to relax and improve swallowing. Another surgical option is the placement of a feeding tube. This may be considered if severe dysphagia is leading to malnutrition. A feeding tube can provide nutrition directly to the stomach or small intestine, bypassing the need to swallow. Lifestyle and dietary modifications are also important for managing dysphagia. Eating smaller, more frequent meals and avoiding foods that are difficult to swallow can help minimize symptoms. Your healthcare provider or a dietitian can provide guidance on appropriate food and liquid consistencies to ensure adequate nutrition and hydration. It's also important to maintain good oral hygiene to prevent infections and complications related to dysphagia. Regular dental checkups and proper oral care can help reduce the risk of aspiration pneumonia and other oral health issues. Regular follow-up with your healthcare provider is essential for managing dysphagia and monitoring your progress. This may include periodic assessments by a speech-language pathologist to evaluate your swallowing function and adjust your treatment plan as needed. If you experience any new or worsening symptoms, such as increased difficulty swallowing, weight loss, or signs of aspiration, contact your healthcare provider promptly. Dysphagia can be a challenging condition to manage, but with the right approach and support, many people can improve their swallowing function and quality of life. It's important to work closely with your healthcare team, following their recommendations, and make necessary lifestyle changes. If you have any questions or concerns about dysphagia, don't hesitate to reach out to your healthcare provider for guidance and support. Thank you for watching. If you found this video helpful, please hit that like button, subscribe to my channel, and leave a comment below if you have any topics you want covered in future videos. As always, take care of yourself and make the most of your day.